Hi, I'm Grace's son, and today we are at Beverly Hills Sleep Center. We're going to have Dr. Ali Ansari talk about sleep apnea.
Sleep apnea is a condition which occurs during sleep, and breathing is abnormal while a person sleeps. It's primarily due to loss of strength of the muscles of respiration in the upper airway. As a person falls asleep, the muscles responsible for control of the upper airway become weaker, and there comes a point in time that the breathing can become shallow and even stop. This shallow breathing or stoppage in breathing can fragment sleep and cause a number of stresses during the night, which can cause a number of medical problems as a consequence.
What really causes sleep apnea?
The weakness of the muscles in the upper airway, and that's a fairly complicated discussion, but as a person falls asleep, the muscles responsible to keep the airway open, they relax. And the diameter of the airway becomes narrow. People start having shallow breathing. And if this problem progresses, there comes a point in time that the airway completely collapses. It can be due to excessive bulk and weight and the adipose tissue in the neck, or it can be by the virtue of collapsibility of the airway, which can even run in the families. This diagram demonstrates the impact of upper airway occlusion and blockage of the upper airway in sleep apnea. Here, the individual is breathing normally, and you look at the tongue and breathing through the nose or mouth, the air passes nicely down to the lungs. As a person has sleep apnea, air comes down, but the tongue slides backwards, occludes the air passage. So no air can go beyond this level. And as you see, the breathing which was normal here stops. So at this stage, breathing stops. Signs and symptoms of sleep apnea, a person will be, in most scenarios, they have snoring during the night, they stop breathing, or the breathing is not uniform, they have shallow breathing followed by rapid breathing, they have frequent awakenings during the night for no reason, and as a result, they get up in the morning, they feel unrefreshed, they're tired, they take naps. There are people who get headaches in the morning, which goes away as the day progresses. There are kids who become irritable, edgy, hyperactive as a result of their sleep apnea. So depending on the population of patients, they can manifest different symptoms, from kids to women to men, elderly, younger. So it can vary depending on the scenario. The prototype would be a middle-aged man who is gaining weight, snores at night, tired during the daytime, and the spouse or significant other notices that the sleep and the breathing is not uniform. There are times that the person stops breathing or has shallow breathing during the night, and during that time the patient can be snoring or with no snoring. Most commonly people snore and they stop breathing, but that's not the rule. There are patients who have sleep apnea with no snoring, which is even more difficult to diagnose. Cardiovascular problems, neurological problems can be due to the stress factor during sleep as a result of sleep apnea. As far as diagnosis of sleep apnea goes, the standard, the routine way of diagnosis sleep apnea would be doing a sleep study in a sleep laboratories such as ours. Patients come in at night, they're hooked up with some electrodes and some sensors. They sleep through the night, which is usually anywhere from 8 to 10 hours of recording time, and during that time they're monitored by a technician who stays over at night. And we look at how they're breathing, what's going on with their brain waves, with their heart rhythm, if they move around in bed, what happens to their oxygen level. So a number of parameters are being measured during that sleep study. The technician will be monitoring the sleep, and real-time reading of the sleep study can be done. And I'm going to show you a brief sample of the sleep study. The breathing stops every minute. As you see, a person is breathing. then they stop breathing, they go back to breathing, they stop breathing. Each time a person snores and stops breathing, the brain waves show that there is a temporary stress. And this stress in the body can be the root of all evil. It can cause a number of hormones to be secreted through the night. These hormones can cause rise in blood sugar and also rise in blood pressure, both explaining to some degree why we end up seeing patients with hypertension or diabetes if this condition remains untreated.